Hello and welcome to the webinar on counselling. This is just a brief overview of counselling, and I've just sort of added it to give information about what you might expect when you go to see somebody. So what is counselling and why do we need this? So counselling is a process of talking about and working through your personal problems. The counsellor usually helps you to address your problem in a positive way, and that helps you to clarify the issues, explore options, develop strategies, and increase self-awareness. And counselling provides confidential support. What can I get help with? So most people find it helpful simply to talk to someone else about challenging issues that they may be facing, and as a way of getting some guidance, advice, or simply just to get stuff off their chest. Why would this be important? It can help you if you're struggling in the world. It can help to deal with personal issues such as loss of a job or a divorce, life experience, stuff that happens, stressful events. And it can be a really stressful time for anyone, and a counsellor can help the person get back on their feet and feel really empowered and actually stronger than ever. And so, yes, you could go to your friends and just have a chat, but professional counselling is provided through a clinician trained who's specifically trained in counselling. The experience and the process itself is actually likely to be different than talking to a friend or other third party who's actually not a trained counsellor. The process. Okay, so what happens? The counsellor is going to ask you to describe what's currently happening for you, and then facilitate your own reflection so you may hear your own emotional or cognitive processing. And this process usually then leads to focusing on what needs to change so you can determine the best course of actions for you. The counsellor might also provide you with suggestions or recommendations for you to follow, and that can help you address your specific concerns. Information you want to give to the person. So what information do I need to share and how is it handled? So what you choose to share from counselling, within counselling, it's actually entirely up to you. However, it's always in your best interest to discuss any issues openly and honestly within that process. And otherwise, it's actually not useful or worthwhile, because if you're withholding information that's critical to you or someone else's well-being, if you're not giving it, the person might not be able to help you sort through the difficulties and process as you go on. Now, some people don't want to go because of the confidentiality thing. Your personal information is always treated with due care and respect, and every registered professional counsellor are subject to strict laws and standards of ethical practice and behaviour related to the management of information, and that it includes a strict privacy laws, and they always follow these, otherwise they can be deregistered. Now, where do you go for counselling, the setting? So if you can't make it in person, a lot of counsellors do over the phone or the internet. You can meet in the park, you can go to the office space. Good research is use a telephone-based or internet counselling. This supports you if you figure out where you want to be and what you want to do. In a crisis intervention service, so like suicide prevention, you've got phone support, you've got places you can go, there's Headspace, there's hospitals, adolescent mental health, domestic violence support. Research where you're going to be comfortable. If you don't want to leave the house, you've got Zoom, you've got FaceTime. Telephone counselling has been used by a lot of people really effectively now over the number of years, and especially with the pandemic, the way it's worked has changed for many people. It's huge. Some people still prefer face-to-face, and others, people don't have a preference. Again, the most convenient ways is usually over the internet, Skype, Zoom, FaceTime. We'll figure out what's best for you. Most registered professional counsellors, they look at your preferred times and accommodate most requests, after hours, weekends, as long as you're reasonable about it. There's types of therapy. Okay, so now there's different types of therapy, and there's not usually a one type fits all. and the clinician usually adapts and uses what they feel is best as the right intervention for you. And this may be one or a mix of different types. So you've got your narrative therapy, talk therapy, schema-focused therapy. It sounds quite complex, but it's cognitive behavioural therapy, interpersonal, psychoanalytic, interpersonal psychotherapy, emotion-focused therapy, hypnotherapy, self-help, problem-solving therapy, psychoeducation, person-centered therapy, and solution-focused brief therapy. Narrative therapy. So this is a form of psychotherapy. It seeks to help people identify your values and the skills associated with them. It provides the person with knowledge of their ability to live with these values so they can effectively confront current or future problems. Your schema-focused therapy, more properly, it's schema-focused cognitive therapy, and that's an integrative approach to treatment, and it combines the best aspects of cognitive, behavioural, experiential, interpersonal, and psychoanalytic therapies, and usually in one unified model. Your behavioural therapy, and that's based on the belief that behaviours learned in response to past experience can be unlearned or reconditioned without analysing the past to find the reasons for the behaviour. And behavioural therapy supports the person to address issues regarding compulsive or obsessive behaviour, fears, phobias, and addictions. That's a little bit different to cognitive behavioural therapy, that combines cognitive and behavioural therapy. So people are taught ways to change their thoughts and expectations, and with accompanying relaxation techniques. So CBT, it supports the person to address issues regarding stress-related ailments, phobias, obsessions, and eating disorders. And additionally, it often accompanies pharmacotherapy interventions when treating major depression. That's like taking medication, tablets. You've got interpersonal psychotherapy, or IPT, and this is time-limited and focused. It's evidence-based approach to treat mood disorders specifically. And the main goal of IPT is to improve the quality of the person's interpersonal relationships and social functioning, and it's going to help reduce their distress. It provides strategies to resolve problems, and these are within the 4 key areas. It's part of schema-focused therapy, and it's a type of psychological treatment. It's actually been shown to help people with a range of different problems like depression, self-harm, relation difficulties, personality disturbance, and functional or so-called medically unexplained symptoms. You've got other types of interventions, and these emotion-focused therapy, EFT, and this is a therapeutic approach based on the premise that emotions are key to identity. And according to EFT, emotions are also a guide for individual choice and decision-making. And this type of therapy assumes that lacking emotional awareness or avoiding unpleasant emotions can cause harm. You've got hypnotherapy, and that's used to create a state of focused attention and increased suggestibility, during which positive suggestions or guided imagery are used. And this helps individuals deal with a variety of concerns or issues. And no, there's no chickens involved. You don't get turned into a chicken. People are really worried about that. Self-care therapy, and the term self-care describes the actions that an individual might take in order to reach optimal physical and mental health. And these include self-help techniques like physical self-care and creating a self-care plan. You've got problem-solving therapy, and that's cognitive behavioural intervention geared, and this is improving the individual's ability to cope with stressful life experiences. And the underlying assumption of this approach is that symptoms of psychopathology can often be understood as the negative consequences of ineffective or maladaptive coping. Psychoeducation. This refers to the process of providing education and information to anyone who are receiving mental health services, like people diagnosed with mental health condition or life-threatening or terminal illnesses and their family members. The person-centered therapy allows the person to see themselves who has the power to change their circumstances rather than an object who accepts their circumstances and position. And by entering into the therapeutic alliance with a counsellor, person-centred therapy assists the client to develop internal resources, and that then allows the person to freely express any emotions and feelings within a safe environment and without judgment. And this intervention enables them to come to terms with any negative feelings that may have caused any emotional problems. Solution-focused brief therapy, and this promotes positive self-change rather than dwelling on past problems. So people are encouraged to focus positively on what they do well, to set goals and work out how to achieve them. And most people respond to this therapy in as little as 3 or 4 sessions. Oh, I've just done them without doing it. I do apologise. How to link in with counselling. To get a referral to undertake counselling, you can direct refer to ask the counsellor directly. Also see your health practitioner for a referral. In Australia, we have a mental health care plan. You can look online for a registered practitioner and follow their guidelines. There's lots of crisis stuff. You've got suicide prevention or callback service. If you go into all the websites for mental health, type of mental health on, go Google, and you'll be able to find lots of references and resources. So this has just been an overview of counselling and how this to link into it, and I hope it's been really helpful. There is a donation button on my website. If you wish to donate, that would be most appreciative. Thank you very much, and I'm going to end that there and say thank you very much. Okay, see you next time. Bye.